I happen to believe, and I know not everybody agrees with me, I believe that health care is a right of all people. I believe that there is something wrong when we are spending...
Excuse me, where did that right come from in your mind?
Being a human being. Being a human being.
All week, we've been examining the health care plans of the presidential candidates. Today, we are giving Senator Bernie Sanders his proposal a checkup here. So to break down some of the specifics of his plan is Fox News Medical A-Team's Dr. Marc Siegel. Thanks for being with us, Dr. Siegel. All right, so we just heard him saying everyone has a right to health care. Well, that just seems to be a no-brainer. Anyone can walk in a hospital right now and get care, right?
That's the great point, Ainsley. This is a rhetoric point because you know what? If you have a heart attack out there, no emergency room in the country is allowed to turn you away. That's your right to health care. Do you have a right to be treated for the common cold? I don't think so. You know, where does that right stop? The right to eyeglasses? You know, these things cost a lot of money.
Who pays for that?
Exactly, and politicians use that as a way to make people feel bad, but we already are covered under the right to health care in this country already. So, you know, the issue of him replacing the current system with socialized medicine we're talking about here, Medicare for all is like what the Canadian system. It may save money. I grant him that. The positive side to this is it would probably be cheaper than the current Obamacare behemoth, which is going to be over $1 trillion a year soon, and Medicare, which is over $600 billion a year. Our healthcare dollar is $3 trillion a year, so we're hemorrhaging.
Outrageous.
This is cheaper, but the question is what's it going to do in terms of quality of care?
All right, so let's talk about Canada, where they have socialized medicine, which is what Bernie Sanders wants to bring here to the United States. What do you think about that as a physician?
Perfect model to use. Canada, 3 months waiting line for a hip replacement. How would you feel about that here? You need a hip? 3 months in Canada.
What about chemotherapy? You might run out of time.
You might not get the chemotherapy you need because personalized medicine is not in place under socialized medicine. In other words, the brand new chemo that we've been talking about that President Carter uses for his melanoma might not be able to get that in Canada. Cardiac stents, Ainsley, which are emergency procedures, over a month waiting line in Canada. Physician shortages are a huge problem in Canada.
What about your doctor? Would you be able to use your doctor?
Yeah, isn't that a joke? You certainly can't keep your doctor now. Wait till under socialized medicine because you know what? Doctors are dropping out of Medicare right now by the droves. It's hard for our elderly to even find a physician or their physician. Many are retiring, many are leaving Medicare. If we make Medicare for all, there's going to be even more of a doctor shortage. You'll get the physician assistant, nurse practitioner, or whatever doctor is available. You're not going to have the same quality of care.
And you wanted to talk about taxes this morning.
Exactly, because how is Bernie going to pay for this system? Well, he'll cut down on premiums for sure, but did you know that your employer is going to have to pay a 6.7% payroll tax? Right now, health insurance is a benefit. So it's a deduction for the employer. He's going to be hit. Your employer will be hit with a 6.7% payroll tax. You're going to have a 2.2% income tax increase. Dividends are going to be hit. Capital gains taxes.
So who
taxes
benefits?
across the board.
Who benefits? This doesn't sound like a good plan.
It's not a good plan. You know, who benefits are the people we do worry about, which are people in the hole where they're not currently insured. So, again, what we said with Obamacare is true here. You ruin the rest of the system to cover the people that really are needy. But I say catastrophic insurance would be a much better approach. Get everybody insurance. Get them catastrophic, not something like this, which is overblown and inefficient. I vote no on Bernie's plan.
Dr. Siegel, thank you for being with us.
Great to see you.
Great series all week long you've been here.
Having fun.
Thank you.
Thank you.